We're so happy now to be joined by Dr. Lisa Hollier, who is ACOG's 2018-19 president. Welcome.
Thank you, Leslie. I'm delighted to be here today.
Well, what do you hope to focus on during your term here?
Leslie, I am really going to be focusing on reducing preventable maternal mortality. What we see in the United States is rising maternal mortality rate over the last 20 years. And this is obviously an incredibly important issue because other countries around the globe have been able to successfully reduce maternal mortality. What we see is that cardiovascular disease currently accounts for about 25% of maternal mortality, or about 1 in 4 deaths. So during my presidential term, ACOG will be continuing its strong efforts to advocate for both state and federal legislation for maternal mortality reviews. These are state-based reviews of the detailed medical records, the autopsy reports of women who have died. And those reviews provide us with the best opportunity to understand the causes and contributing factors, and to be able to identify areas where we can implement solutions that prevent women from dying. The second part of the initiative focuses on the implementation of a culture of safety in hospitals. ACOG has currently been working very closely with the Alliance for Innovation on Maternal Health to implement safety bundles in all delivery facilities across the country. Right now, AIM, as it's called, is working in 18 states, but we hope to see that expand. And finally, I will be starting a new presidential task force, the Task Force on Pregnancy and Heart Disease. As I mentioned, cardiovascular disease and cardiomyopathy account for about 1 in 4 maternal deaths. So what ACOG will be doing with this task force, which is chaired by Dr. Jim Martin, a past ACOG president, is to identify evidence-based guidelines for screening, diagnosis, and management of heart disease before, during, and after pregnancy.
A lot to focus on.
Absolutely.
Well, what are you most looking forward to about this position, and what will happen?
I'm really excited about having this opportunity to focus on preventable maternal mortality. I've been working on it for a number of years. I think, though, one of the most enjoyable aspects about having this opportunity, in addition to working on special programs, is simply the chance to go out and meet our fellows, to understand what our members want from ACOG. Are they happy with what ACOG is currently doing for them? And really just get a broader understanding of the needs of our membership and our responsiveness as an organization. So I'm really looking forward to spending time with ACOG members, not just in the United States, but in Canada and Mexico as well.
And what do you want those members to know?
I think the members need to know how much this organization is truly there to support them. ACOG has a number of new strategic initiatives to provide our members with the tools that they need to be able to provide the very best care for women in their practices every day, and to really be able to facilitate the relationship, that direct communication with the patient, rather than having our clinicians focus in on that electronic medical record. So I'm really hopeful that our innovative solutions will be of significant benefit to all of our physicians who are practicing.
Now, you mentioned policy in one of your 3 focus areas. What do you want, or is there anything that you want policymakers in Washington to know?
Absolutely. We have federal legislation right now before the House and the Senate that provides infrastructure for state-based maternal mortality reviews. So I want our policymakers to know how incredibly important this legislation is and how valuable it would be if we could pass this legislation. It's my understanding that the Senate will actually be voting on this legislation next month, and we really need this legislation to come before the House and have the House vote on it as well.
You have a lot in front of you, I know, but good luck on your term.
Thank you so much, Leslie.
Dr. Lisa Hollier, thanks a lot for being here.